Hi, I'm April Clifton. I'm going to be doing my full head to toe assessment. Can you please scan the room for any notes? Alright, before entering the patient's room, I would check the chart, knock on the door, and hi, I'm April. I'm going to be your nurse today. I would provide privacy and wash my hands. Can you verify your name and date of birth, please?
Teresa Peak, 1/24/1990.
Alrighty, and what brings you in today?
I'm just here for a physical assessment.
Okay, are you in any pain at all?
No.
Okay. Just looking at my patient, she is sitting erect. She seems to be comfortable. She is dressed appropriately for this setting. What day is it?
Today is Wednesday.
Okay. And where are we?
We are at Baker College.
Okay. And who's the president?
Donald Trump.
Okay. My patient was able to state her name, date of birth, where we are at, what day it was, and who the president was. So she is alert and oriented ×3. I'm going to be doing an assessment on you today. Some portions are going to involve me touching you. Some portions I'm going to have you walk and do a couple of movements. Are you okay with that?
Yep.
Okay. I'm going to start with an assessment on your head. Just observing the patient's head. The patient's head is normocephalic. Hair is appropriate for ethnicity. It is clean. I note no foreign bodies such as bugs. It is evenly distributed on the head. Taking a look at the eyes. The eyes are midline and symmetrical. The nose is midline and symmetrical, as well as the mouth. She has glasses on, so it's easy for me to line the top portion of her ears with the outer canthus of her eyes. I'm going to feel on your head. If at any time you feel any pain or any discomfort, just let me know, okay? Any pain?
No.
Alright, I note no lumps, bumps, or lesions, and she did not have any pain with palpation. Any history of headaches?
No.
Okay. Any head trauma?
No.
Okay. Nothing that would hurt your head at all?
No.
Okay. I'm moving on to the face. The skin is evenly distributed. She has nice pink undertones. I do not see any macules or pustules. I'm going to feel on your temporal arteries, okay? Temporal arteries are equal bilateral +2. I'm going to feel on your frontal sinus and your maxillary sinus. Do you have any sinus problems?
No.
Okay. Any pain, problems breathing?
No.
Nothing like that. Do you have a history of sinus infections?
No.
Okay. I'm going to push. If it hurts, just let me know, okay?
Okay.
The frontal sinus is palpable, as well as the maxillary sinus. She said, did that hurt at all?
No.
Oh, okay. Okay. I'm observing your eyes. I do see that she has even distribution of her hair on her eyebrows and her eyelashes. She does wear glasses. Do you see an eye doctor?
I do.
Okay, when was the last time you seen him?
Within the past year.
Within the past year? Okay. And when you go to the eye doctor, does he test your chart or test your eyes by using a chart on the wall?
Yes.
Okay, so that's the Snellen chart. If she was not to see a eye doctor regularly, then I would test her vision through that preference. Go ahead and take your glasses off for me. Observing the eyes, the sclera is white. The pupils are equal and round. The irises are, they're like hazy right now. Just by looking at her, her eyes are not twitching. She has what appears to be full range of motion in them, like full control over them. Can you go ahead and pull down your, alrighty. The conjunctiva is pink and moist. Alrighty, I'm gonna look in your eyes, okay? If the light's too bright, just let me know. Okay? I'm gonna look, flash a light twice in each eye, okay? Okay. Alright, the pupils are equal, round, and reactive to light. Go ahead and stare straight ahead, and when I say now, go ahead and look at my pen light. Now? Alrighty. The eyes accommodated. Just observing the eyes, the pupils are about a 5 centimeter or 5 millimeter. And when I flashed the light in her eyes, they did accommodate or the pupils did dilate correctly. Alrighty. Moving on to the nose. So you said you had no problems with your sinuses. Do you have frequent nosebleeds?
No.
Okay. Do you have a runny nose? Okay. Do you notice that you have to blow your nose a lot?
No.
Okay. Can you go ahead and push on the side of your nose and breathe in through the other nostril? Okay, and do the same for the other. Okay, she has normal patency. Like I stated before, the nose is midline and symmetrical. I'm going to look inside of your nose now, okay?
Okay.
Alrighty. The nose is free of any objects. She has some hair present, but that's normal. There's no septum or nasal deviations, no perforations, or anything like that. That's cranial nerve 1. She has no problems with her smell. If I was to wave something under your nose, would you be able to smell it for
Yes.
me?
Yep.
Okay, so no changes in smell?
Nope.
Okay. So that's cranial nerve 1. I tested cranial nerve 2 by asking her past medical history on her eyes, seeing that she uses an eye doctor. Go ahead and I'm going to have you follow my pen light, okay? Just move your eyes, don't move your head, okay? Okay. The eyes moved smoothly. There was no ticking or any tremors in the eyes. So that test cranial nerve 3, 4, and 6. Moving on to the ears. Do you have any problems hearing?
No.
Okay. Do you have any past medical history of ear surgeries?
No.
Okay, so no tubes in your ears. Okay. And do you clean your ears out with Q-tips?
No.
Okay, good. That can cause some problems. All right, I'm gonna feel in your ears, and then I'm gonna look inside your ears just to get a little feel of what's going on in there.
Mm-hmm.
If I can find my pen light. There it is. All right, I'm feeling on your ears, so I'm going to push on the tragus, pull on the penna, and push on the mastoid process. Okay, any pain at all?
No.
Oh, okay. I'm gonna look inside both of your ears, okay? Just keep your head straight forward. Okay, there's nothing in that ear but a little bit of cerumen. Okay, nothing in that ear, but a little bit of cerulean, which is a normal finding. She has no, nothing abnormal in there. You can go ahead and put your glasses back on. I'm done with the eyes. Alrighty. I'm going to perform a whisper test. I'm going to go behind you, and I'm going to make a little bit of noise in the back of you. You just tell me what side it's on, okay?
Okay. Right ear. Left ear.
And now.
Nothing.
Okay. Alrighty. That is cranial nerve 8. I am going to have you do the Romberg's test when I have you stand up. I just don't want you getting up and down too many times, okay? Alright, and now I'm going to move on to the face. I'm going to use one of these little doohickeys. Cotton tipped applicator. I'm going to poke your face, and then I'm going to use the soft side to touch your face. Just tell me where you feel it and what you're feeling, okay? Close your eyes.
Sharpen my forehead.
Yeah.
Sharpen my forehead.
Okay.
Soft on my left cheek. Sharp on my nose. Sharp on my chin.
Okay.
Sorry. I can just feel it. Sharp on my right cheek.
Okay. So that's cranial nerve 5. She did say sharp for a little bit of the soft portions, but I'm pretty sure it was because it was tickling. She kind of laughed a little bit. All right, I'm going to now test your jawbone, your for any TMJ, okay? All right, I'm going to open your mouth, close, move side to side. Okay, I know. I know, no clicking or anything like that. She was able to open her mouth appropriately and move side to side. So that lets me know that cranial nerve 5 is intact. Do me a favor and puff out your cheeks and raise your eyebrows. Ooh. And smile and frown. Okay. So that lets me know that cranial nerve 7 is intact. Just observing the mouth. The lips are pink and moist. Appropriate for the face. Okay, go ahead and open your mouth and say ah. Okay, the soft palate and hard palate are intact. The uvula does rise when saying ah. Buccal mucosa is present. Lift up your tongue. Okay, and then go ahead and pull your gums are pink and moist, as well as the buccal mucosa. I did note that she does have a little bit of dental work. Do you see a dentist regularly? Okay, when was the last time you seen him?
Probably 6 months ago. Okay,
alright, sounds good. Go ahead and look up at the ceiling and swallow. Okay, alright, and then you can let your head down now. So that lets me know that you're having no problems swallowing. Any problems chewing or when you're eating food?
No.
Do you have problems choking on food?
No.
Okay. Cranial nerve 9 is intact with her gag reflex. If there were any concerns, I would dig further into that investigation. With the soft palate and the uvula rising, cranial nerve 10 is intact. Go ahead and say light, tight, and dynamite.
Light, tight, dynamite.
Alrighty. Cranial nerve 12 is intact. Gonna be feeling on you again. I'm gonna push on your shoulders, or I'm gonna put my hands on your shoulders, just shrug up,
Okay.
and then I'm gonna touch your face, and then you just resist my touch, okay?
Okay.
Okay. Okay. She was able to do that appropriately, so cranial nerve 11 is intact. I'm going to feel on your head a little bit more. I'm going to be feeling your lymph nodes. If at any time it hurts, just let me know, okay?
Okay.
I'm doing the preauricular. post-auricular, the occipital, and I'm doing this on both sides at the same portion on each side. Okay, I'm doing the superficial cervical, okay, and then turn your head to the side and tilt your head down. Alright, deep cervical, and to the other side and down. This is the deep cervical as well. Okay, and then I'm doing the posterior cervical, just right back here, all the way down here. And then lean your, like shrug your shoulders over so I can just see your clavicles. Okay, and this is the supraclavicular. Okay, and then I'm going to test your skin turgor while I'm right here. It returns to normal. No signs of dehydration. While assessing the...
Hands are just sweaty.
Oh, that's okay. While assessing the lymph nodes, I noted no palpable masses. If they were, they would be about the size of a pea, and they would be non-movable. Okay. Any questions so far?
No.
Okay. I'm going to go ahead and I'm just going to feel your carotid arteries. I'm going to do one at a time so I don't choke you, okay? Oh, that's good. All right, carotid arteries are equal bilateral, and they're about a +2. I'm going to listen to your neck as well. I'm going to have you blow out, or breathe in and then blow out. I'm going to have you hold your breath just for a little bit. If at any time you feel like you can't breathe or you feel like you need to get some air, just let me know, okay? I'm going to be listening to her neck for her jugular, or for her carotid artery to find any abnormal findings. I'm going to be using the bell of my stethoscope. Alright, deep breath in, breathe out. Okay. How you feeling?
Good.
Okay, I'm going to move to the other side now.
Okay.
Deep breath in and breathe out. Hold it. Alright, go ahead and breathe normally. How you feeling?
Good.
No dizziness or anything like that?
No.
Okay. Alrighty. Just assessing my patient as she's sitting right now. I know that she's not using any accessory muscles. She has a normal affect. She does not have any tremors or any involuntary movements. Oh, I got that one out. Now I'm going to be assessing your heart and your lungs. Do you have any heart problems?
Not that I know of, no.
Okay, do you have a family history of heart problems?
No.
Okay. And do you have any lung problems?
No.
Okay. Any history of smoking?
No.
Okay. And any family history of lung problems?
No.
Okay. Alright. While I'm listening to your heart, I'm also, when I'm done with that, I'm going to be listening to your lungs. So your chest is going to be exposed for a little bit. If you feel uncomfortable, we can change the gown around, okay?
Okay.
Alrighty. I will be mapping out her lung fields, starting at the apices of the heart, or of the lungs, right up here. Going to be listening to here, and then going down to about the 5th or 6th intercostal space. So I'll be listening from here to here, and I will be listening bilaterally on both sides. Okay? Okay, so I'm just observing the skin. Skin is warm to touch. I do note some maculae and some freckles. Do you have a problem with acne at all? Okay, alrighty. So after inspecting, I note that the skin has nice pink undertones. I'm going to percuss the lung fields now. Gonna move this over just a little.
Okay.
Sorry, I gotta touch you.
No, you're fine. Just move them, whatever you gotta do.
Alright, now I gotta feel down here. Go ahead and move them up. Okay.
Sorry if I'm sweaty.
You're fine. Listen, I have the problem too. It's okay. I'll get the sides of your chest when we go to the back, okay? Okay, did that hurt at all?
No.
Okay, lung sounds were tympanic throughout, no residual sounds or anything like that, no dullness throughout the lung fields. Gonna listen now. I'm gonna listen to your lung fields using the diaphragm of my stethoscope. Just breathe normal, okay?
Okay.
Going up underneath again. Okay, lung sounds were heard throughout, no adventitious sounds. I heard no cracking, no wheezing, anything like that. Moving on to the heart, I'm going to feel for the sternal notch, which is going to be located right here. I'm going to go over to the second intercostal space, right sternal border for the apices of the heart. Going straight over to the left intercostal space to the pulmonic, and going down one to the third intercostal space to on the left sternal border to Erb's point. Going to be going up under here to about the fifth intercostal space, right sternal border to the tricuspid valve, and then the same for the mitral valve, the fifth intercostal space, mid-clavicular. Okay?
Okay.
Gonna be listening. You hot? It's hot in here, huh? Alright. Go ahead and just breathe normally, okay? Okay, going up underneath here. Alright, as S1 and S2 noted throughout. Did diminish just a little bit as we got down to the lower portion of the heart. I heard no adventitious sounds, no murmurs, no flutters or anything like that. I'm going to move to the anterior portion of your chest. Okay. Or to the posterior portion of your chest. I was just at the anterior portion. Okay. Just observing her back. Her skin is warm to touch, nice pink undertones. You're fine. Note some macules on the back, just a little bit of freckles. Go ahead and hunch over, like the hunchback in Notre Dame. Okay. Feeling her spine is midline. Okay, go ahead and sit up. So it does not deviate to one side or the other. No speculations of scoliosis. Gonna feel for the spinal notch, which is gonna indicate C7. This is just mapping out her lung field from C7. Go ahead and make your chicken wings flat. Go for it, yeah. Okay, scapula is, like, push your scapula back. Oh, there you go, there you go. Okay, so going down to the scapula, you can relax your arm. Going down 3 to about T10. Just going to use this as my lung field. I'm going to be percussing, auscultating, all the good things like that for this. Do you have any problems with your back?
I do not.
Any back pain?
Nope.
Any problems when you bend over?
Nope.
Oh, okay. I'm going to percuss now. I'm going to be moving your bra just a little bit so I can get right on your skin so I'm not having anything interrupt, okay?
That's fine.
Pulling up on the bra. For the purpose of this video, I did do one side at a time, just so it's more comfortable for the patient with having to move the bra. Line up. All right. Fix your bra for you. Okay. After percussing, I know there are no. It's equal throughout. I heard no areas of extreme dullness, no areas to be concerned about. Now I'm just going to do tactile fremitus. I'm going to put my hands on her back and have her say 99 throughout the entire lung field, okay? So every time I touch you, just go ahead and say 99.
99. 99. 99.
Sorry.
No, you're fine.
You're fine.
99. 99. 99.
Okay. So after saying 99, she did have vibrations throughout. Did feel vibrations throughout the whole entire lung field. They did diminish as they went down, becoming a little more lessened at the bottom. Okay. I'm gonna do AP diameter now. So I'm gonna like feel on the side of you, and then measure your back. Gonna be on the bed with you just a little bit, okay?
Try to switch back for you.
Okay. Oh, there you go. That's good. Okay, raise your arm up just a little. Feeling for the rib cage. Going right here. Feeling this portion for that. Now I'm gonna move my hands around to the back and go right here. So she's about 2-to-1 ratio, which is a normal finding in that situation. I'm gonna do your symmetrical expansion. So I'm gonna like feel how good your lungs expand together.
Okay.
So go ahead and breathe out. And then take a deep breath in and out. Okay, symmetrical expansion was even. They moved at the same time. I'm going to listen to your lungs now. Moving your paw up. Okay. Lung sounds were present throughout. I heard no adventitious sounds, no cracking, no wheezing, no indication of bronchial flare-ups. Fixing your brow just a little bit. Okay, now I'm gonna move back around to the front of you. This time I'm gonna lay you down. Have you lay on the bed. I'm gonna be doing some work on you while you're on the bed, okay? Go ahead and cover up. Get you nice and comfortable. Okay, patient is lying supine. I do not note any bulging of her jugular vein, so she has no jugular vein distension. If she did have jugular vein distension, I would raise her to about a 45-degree angle to see if that distension went away. After observing the patient's neck, I do not see any masses or anything like that, and when I had her look up and swallow, there were no bulges there either, so there's no indication of problems with the thyroid. Just overall looking at the skin, skin on the abdomen, nice and warm, nice pink undertones. Skin on the arms, it's nice and warm pink undertones. Hair is evenly distributed on them. Going down to the legs. Legs are nice and warm with nice pink undertones. Same as the feet. I'm gonna cover you up here just so I can do my assessment down here, and then when I go back up there, we'll get you taken care of. Okay, so do you have any problems with your legs?
No.
Do you have any problems with your feet when you're walking?
No.
Okay. Any problems with joints when you're bending your knees?
No.
Okay, go ahead and bend your knees up, both of them. Okay, and down. Okay, I know that she has good range of motion with her knees. And then I'm going to be doing some testing on your feet. Just gonna feel for your pulses first, and then I'm gonna be feeling on your legs a little bit too.
Okay.
So I'm feeling for the popliteal pulse, feeling behind the knees. Sometimes you're not able to feel it. So her popliteal pulse is non-palpable, which it's a normal finding in some cases. Gonna check her dorsalis pedis, which is on the top of the feet. Just feeling for the pulse. Okay, so I feel it right in here. Dorsalis pedis is equal bilateral +2. Now I'm going to feel for the posterior tibialis pulse, which is on the inner portion of her ankles. Okay, that is an equal bilateral +2. I'm going to check the capillary refill in your toes.
Okay.
Might tickle a little. Okay, capillary refill is less than 3 seconds, so that's a normal finding. Gonna tickle your feet a little bit, okay? Tell me when you can feel my touch. Okay, gonna lift your leg up just a little so I can feel it, or so I can get to it.
I feel it. Yep. Yes.
Tickle?
Yeah. I feel it in my heel.
Okay. Next foot.
Yep. 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 My heel. Oh, I feel it. You're tickling me.
Oh, okay. Sorry. I feel it. You're tickling me. All right. So I know she has sensation equally in both feet. No problems with that. I'm gonna do the Babinski test. I'm gonna run my pen light up both of the sides of your feet. Okay. All right. So I know that her toes did stay the same. Another normal finding for an adult would be their toes would curl in. If they did have any flaring of the toes, then that would be suspicion. Observing the legs, the hair is evenly distributed. Visually, I know no edema. Just gonna check on some bony prominences. All right, she has no edema there. No edema there. Okay. Moving back up to the arms, I'm going to feel on your arms for your pulses first, okay? So I'm doing the brachial pulses. Testing them equally. Okay, those are about a +2. Gonna do your radial pulses. Can you bring your arms just a little? Yeah, there you go. Okay, radial pulse is a +2, equal bilaterally. I'm just looking for any edema. There's no edema present in the arms, and after I felt on bony prominences, there was no edema. Gonna check your capillary refill now on your fingers. Okay, capillary refills on the fingers were less than 3 seconds, so that is a normal finding. I'm going to test your strength on your hands.
Okay.
Go ahead and squeeze, and then resist, and resist. Okay, that is equal as well. Moving on to your abdomen, I'm going to first inspect your abdomen. Oh, I'm gonna look right here.
Oh, yeah.
Oh no, you're fine. You're fine. So inspecting the apices of the heart. I know no heaves or lifts or anything along that nature. Do you have any abdominal pain?
No,
Okay. And how's your bowel movements?
they're normal.
Okay. And how's your eating habits?
Trying to eat healthier.
Trying to eat healthier. Okay, so nice vegetables will help them bowels, okay? And your reproductive system. Have you had any kids?
Nope.
Okay. And are you sexually active?
Yep.
Okay. And do you take birth control?
I do.
Okay. And do you wear protection?
No.
Okay. So the health department will provide condoms if you need to, if that's something, or if you are trying to get pregnant, then a fertility doctor could help.
Okay.
Any pain in your abdomen at all?
No.
Okay, so I'm gonna start in the right lower quadrant. Before I do anything, I'm gonna listen so I don't stir anything up. Okay, bowel sounds are present in all four quadrants. I do note the umbilicus is midline, does not deviate to either side, so that's good. Her abdominal distension is, it's flat. She does have a little bit of puffiness in the abdomen area, but that's to be expected. When was your last menstrual cycle?
Maybe a week ago.
Okay, alrighty. And how are those?
They're normal every month.
Okay. So I'm going to listen to your arteries in your stomach.
Okay.
Any problems with your stomach, such as do you feel any like palpitations in your stomach?
No.
Any poundings? Any like swishing feelings?
No.
Okay. Gonna listen to the abdominal arteries starting at the atria or aorta, which is right here. Okay, moving down to the renal arteries. Okay, going down to the iliac. Alright, I hear no adventitious sounds, no bruits, no murmurs, anything like that. For the purpose of this video, we're not going to auscultate the femoral arteries, but I could find them right here, located in this area. I'm now going to finish my inspection in the abdomen. I'm going to feel on your stomach and listen, okay? So I'm going to first start with oh, nice bowel sound there. Getting things stirred up. That's all right. Bowel sounds are tympanic throughout. Didn't hear any areas of dullness. Does have very active bowels. I'm gonna push on your stomach, okay?
Okay.
Let me know if it hurts at all.
Okay.
Alrighty. I will not be doing any deep palpations. If I did have any suspicions of abdominal problems, I would deeply palpate. Now I'm going to go back down to the feet, gotta have you do some strength tests.
Okay.
Okay, push on my hands and resist, and then pull up. Okay, strength is equal on those. Go ahead and sit to the edge of the bed. Go ahead and put the gown back on. Gonna have you stand up. Alright, so going back to that cranial nerve 8, I'm gonna be doing the Romberg's test. Vision or hearing was good for that. I'm gonna put my hands out and close your eyes. She does not sway to either side, so that is good. Go ahead and open your eyes. So cranial nerve 8 is intact. Do me a favor and walk to the table and walk back. Okay. Patient has a normal gait. She does not seem to be favoring either limb. Her arms sway evenly. Go ahead and turn your head in a circle. Do you have any problems with your joints at all?
No.
Okay, does it no joint pain when you walk?
No.
Okay, and so that lets me know that her range of motion in all extremities are good because I did have her push and pull on my arms. Go ahead and put your arms up to the side and touch your nose. And touch your nose. Okay, so that is good. Now I'm gonna have you do the test where you slide your foot down your shin. Yeah, the heel shin test. Okay, and now the other one. Okay, I don't know abnormal findings for that. She was able to perform all my tasks. You can go ahead and have a seat. She was able to perform all my tasks. Her range of motion was good. She is alert and oriented ×3. Her affect is appropriate for the setting. She's dressed appropriately for the season. Because she is alert and oriented and she was able to answer all my questions clearly. Her speech is clear. I do give her a Glasgow Coma scale of 15. That's a normal finding. So, any questions?
No.
Alrighty. Thank you.